Immunization. Outline. Introduction. Basis of immunization. Classification of vaccines. Recommended immunization schedule. Bcg Vaccination. Polio Vaccination. Dpt Vaccination. Typhoid Vaccination. Cholera Vaccination. Measles Vaccination. Mumps Vaccination. Rubella Vaccination. MMR Vaccine. Influenza Type B Vaccine. Hepatitis B Vaccine. Hepatitis A Vaccine. Varicella virus Chickenpox Vaccine. Combination Vaccine. Polyvalent Pneumococcal Vaccine. Meningococcal Vaccine. Japanese Encephalitis JE Vaccine. Vaccination against rabies. Introduction. Immunization programs from the sheet anchor of the preventive services available today. These aim at preventing disease by producing controlled clinical reactions which are likely to confer effective and, as far as possible, lasting resistance to infections, the so-called immunity. Unfortunately, effective vaccines are not being used on a scale that is needed to provide tangible results. Studies clearly indicate that the immunization status of our pediatric population is as yet far from adequate. Basics of immunization. Vaccination is the process of inoculating the antigen vaccine into the body regardless of its seroconversion. Immunization is the process of inducing immune response, humoral or cell-mediated, in the body. Primary immune response occurs when an antigen is introduced for the first time, and the immune system responds primarily after a lag phase of up to 10 days. On reintroduction of the same antigen, there is no lag phase. The immune system responds by producing antibodies immediately. This is called secondary immune response. Secondary response is immediate, long-lasting, has very high titer. Immune response may be 1. T-cell dependent. 2. B-cell response. T-cell dependent response involves both T-cell and B-cell. It is prompt, IgG type, longer lasting, and with high titer, and shows booster effect with repeated exposures. It also reduces carrier state because of production of LGA. After 6 weeks of age, this response is evident. T-cell independent response is only B-cell mediated. It is mainly IgM type, short-lived, shows revaccination rather than booster effect, and does not reduce carrier state. It occurs after 2 years of age only. Conjugation is a technique whereby T-cell independent antigen polysaccharide can be made into T-cell dependent. The conjugated vaccine can be given under 2 years of age. Examples: conjugated HIB, pneumococcal, VI, typhoid, meningococcal vaccines. Categories of vaccines. Vaccines may be live attenuated, LAV, or killed inactivated. LAVs are capable of replicating within the body and stimulating immune response. Killed vaccines do not multiply in the body and need to be given in multiple primary and booster doses. Bacterial. Live, BCG, typhoid. Killed, cholera, pertussis, tetanus, diphtheria, meningococcal, H. Influenza type B, pneumococcal. Viral: live, polio, sabin, measles, mumps, rubella, yellow fever. Killed: polio, salk, rabies, hepatitis B, influenza, Japanese fever, encephalitis. Cold chain: the cold chain is a system of storing and transporting vaccines at low temperature from the manufacturer to the actual vaccination location so that their potency and efficacy are preserved. The cold chain equipment consists of cold box. This can transport large quantities of vaccines by vehicle to outreach sites, preserving the vaccine for up to 1 week without any power supply at all. Vaccine carrier. This is designed to transport small quantities of vaccine by a vehicle, bicycle, or on foot to outreach sites, preserving the vaccine for up to 3 days. Flask. This is only a substitute for carrier but should not be much encouraged. Ice packs. These are employed for use in box, carrier, or flask. Note that storing OPV in deep freezer with a temperature of -20 degrees Celsius enhances the life of the vaccine from 3 months to 1 year. Recommendations on storage of vaccines in the refrigerator. Compartments. Vaccines. Freezing compartment, OPV. Main compartment. Top, BCG, measles, MMR, mumps. Middle, DPD, DT, TT, Hep A, Hep B. Lower, diluent. Some additional immunization related matters. Vaccine Wheel Monitoring, VVM. If the small square within the circle matches the circle or becomes darker, the vaccine needs to be discarded even if its expiry date is still away. Route of administration. Sabin polio vaccine, OPV, and typhoid TY21 are the only vaccines given orally as of now. Live vaccines, measles, MMR, are best given SC and deltoid area of older children. BCG is given ID, usually over volar surface of forearm. Most vaccines, typhoid, DPT, HP, HA, HIB, are given IM in infants over enterolateral aspect of thigh in infants and deltoid in later age. Safe injection practices. These should include separate syringe and needle for each injection, separate anatomical sites and separate limb for multiple injections. Observation of the child for at least 15 minutes after administration of an injection. Recommended Immunization Schedule. The National Immunization Schedule. Beneficiaries, age, vaccine, number of doses, route of administration. Infants, 6 weeks to 9 months, DPT, 3. Intramuscular, 6 weeks to 9 months, polio, 3. Oral, birth to 3 months, BCG, 1. Intradermal, 9 to 12 months, measles, 1. Subcutaneous. Children, 18 to 24 months, DPT, 1. Intramuscular, 18 to 24 months, polio, 1. Oral, 5 to 6 years, DT, 1. Intramuscular, 5 to 6 years, typhoid, 2. Subcutaneous, 10 years, TT, 1. Intramuscular, 10 years, typhoid, 1. Subcutaneous, 16 years, TT, 1. Intramuscular, 16 years, typhoid, 1. Subcutaneous, Pregnant women 16 to 36 weeks. TT 1. Intramuscular. Booster doses 2 doses if not vaccinated previously. Bcg Vaccination. Bcg, Bacillus of Calmette and Guerin vaccine, is an attenuated live vaccine obtained from the bovine strain of tubercle bacilli. It produces controlled primary tuberculosis infection. The current practice is to employ heat-stable, freeze-dried powder to be reconstituted using normal saline, which should preferably be stored at 2 to 10 degrees Celsius. Vaccination Schedule. In India, as in other developing countries, direct primary vaccination against tuberculosis is recommended at birth or earliest contact after birth. Site. The standard site in the middle of deltoid just above its insertion over the left upper arm. Method. 0.1 milliliter, 0.05 milliliter in neonates of BCG is injected intradermally with a special tuberculin syringe. For mass immunization, the jet injector is of distinct value. Polio vaccination. Oral polio vaccine, OPV, Sabin vaccine, is a live but attenuated virus. Storage is best done at 2 degrees to 10 degrees Celsius since it is cheaper, easy to administer, helps to prevent establishment and spread of wild pathogenic poliovirus in the community, and can be used in blanketing operations to check the spread of an incipient outbreak. It is being used by a large majority of the countries the world over. This has earned it the designation community vaccine. The killed inactivated injectable polio vaccine, IPV, the so-called Salk vaccine, is required to be administered parenterally. It does not interfere with the spread of natural virus in the community, though it does provide individual immunity to polio. Age of vaccination. As per current recommendation of the Indian Academy of Pediatrics, primary doses are given at birth, 0 dose, then at 6 weeks, 10 weeks, and 14 weeks. A booster dose is given in second year, 15 to 18 months, and yet another in the 5th year. A total of 6 doses are, therefore, recommended to ensure reasonably high personal protection from poliomyelitis. Administration. OPV is administered as 2 drops directly into the mouth. This should be followed with the feeding of some water to ensure absolute ingestion of the vaccine. Enhanced Inactivated Polio Vaccine, EIPV, Salk vaccine. Dosage schedule. 0.5 milliliter SC in lateral thigh in infants and deltoid in grown-up children at 8 and 16 weeks or 6, 10 and 14 weeks. Booster is required at 15 months. Storage 2 to 8 degrees Celsius. Dpt Vaccination. Dpt triple vaccine offers combined prophylaxis against diphtheria, pertussis, and tetanus. Both whole cell and acellular vaccine are available. The vaccine is best stored at a temperature of 2 to 10 degrees Celsius. Vaccination Schedule. Primary vaccination consists in giving 3 doses at the age of 6, 10 and 14 weeks, followed by booster at 15 to 18 months and 5 years. Administration. A dose of 0.25 to 0.5 milliliter of the triple vaccine is given deep intramuscularly over the lateral thigh or the deltoid. Contraindications. Severe reaction to previous DPT injection. Progressive neurologic diseases. Typhoid vaccination. Currently recommended vaccines are: number 1, oral typhoid vaccine, oral S, Typhi, Typhoral, and number 2, injectable VI, capsular polysaccharide typhoid vaccine, Typhim VI, Vac Typh, Typhivax, Typho V, Tyax V. Number 3, classical whole cell killed TA vaccine, as it also includes S. paratyphi A4. Oral typhoid vaccine. It contains Ty21 live attenuated mutant strains of S. typhi. The dose is 1 capsule on day 1, 3, and 5, 1 hour before a meal, given every 3 years. Polysaccharide V typhoid vaccine. It contains purified V capsular polysaccharide VICPH. The dose is 1 injection, 0.5 milliliter, containing 25 mg of VCP9, given SC or IM as a single dose every 3 years. Cholera vaccination. The currently available cholera vaccine, required to be given by the subcutaneous injection, has a protective value of around 50% for period of 3 to 6 months. The dose is 0.3 milliliter and 0.2 milliliter for children above and below 2 years, respectively. 2 doses are given at an interval of 4 to 6 weeks. Reactions include local pain, erythema and edema. Occasionally, abscess formation may occur. Fever is unusual. The existing vaccine is a saline suspension of about 12,000 millions cholera vibrio per milliliter, killed and preserved in 0.5% phenol. Measles vaccination. A live attenuated measles vaccine, Schwartz strain from chick embryo tissue culture, Edmonston strain from human diploid cells, has a definite protective value of as high a magnitude as 95 to 100%. Age of vaccination. The national recommendation for measles vaccine is at 9 to 12 months of age, with revaccination at 15 to 18 months in the form of MMR vaccine. In high-risk situations, it may be given earlier, but in that event, it must be repeated after a gap of 6 months. Dosage: 0.5 to 1.0 milliliter SC ID IM. Mumps vaccination. Again, like measles vaccine, it is a live attenuated virus obtained from the Gerald Lynn strain, named after the child from whom it was isolated. Its protective value is of the order of 95%, and it probably gives long immunity. It is supplied as lympholyzed powder, which on reconstitution should be used promptly. The dose is 317 TCID, tissue culture infective dose, which should be administered subcutaneously or by jet gun. Mumps vaccine is very safe. Rubella vaccination. Rubella vaccine 2 is a live attenuated vaccine. Indication: immunization of girls from 1 year to puberty, susceptible women of childbearing age with hemagglutination test negative, provided they are not already pregnant and conception is unlikely in the subsequent 2 months. Dose: 0.5 milliliter SC upper arm as a single dose. MMR vaccine. Indication: MMR, a live attenuated vaccine, Priorix, is recommended as a backup dose for protection against measles in the 2nd year of life at around 15 months of age, at least 3 months following primary measles vaccination in the 1st year. Dose: 0.5 milliliter SC at 15 to 18 months. H. Influenza Type B Vaccine. This vaccine, Hybrid, Hybest, ACT, HIB, HIB titer, aims at protecting against H. influenza type B infection, pneumonia, epiglottitis, meningitis, which is believed to cause significant morbidity and mortality in infants and toddlers. At least 4 conjugate polysaccharide HIB vaccines are available, namely 1. Diphtheria toxoid conjugated vaccine PRPD. 2. Oligosaccharide conjugated vaccine HBOC. 3. Meningococcal OMP conjugate vaccine, and 4. Tetanus toxoid conjugated vaccine HIB-TT PRPT. Indications. IAP now recommends it as a routine vaccine for protection against H. influenza type B, usually simultaneously with DPT. Dose: 10 mg 0.5 milliliter IM. The vaccine is administered in 3 doses at 6, 10 and 14 weeks. Booster is recommended at 15 to 18 months. If the child first reports between 6 and 12 months, only 2 primary injections, and greater than 1 year, only 1 injection is recommended. Hepatitis B Vaccine. Hepatitis B vaccine consists of hepatitis surface antigen-related protein, a highly purified suspension of inactivated alum-adsorbed HBsAg particles. The World Health Organization (WHO) recommends incorporation of the hepatitis B vaccine as the 7th vaccine in the routine immunization. Post-exposure prophylaxis. According to IAP recommendation, if the pregnant woman is a known carrier of HB virus, her neonate should be given HB immune globulin HBIG within 12 hours of birth, and also 1 dose of HB vaccine with a separate syringe and needle over a different side on the body. Hepatitis A Vaccine. Indication: active immunization against hepatitis A, especially in children who are less likely to have developed natural immunity because of a sophisticated lifestyle. Dose: killed vaccine, Havrix. It is given intramuscularly as a single dose, 720 units from 1 year to and including 18 years, and 1,440 units from 19 years onward. A booster is recommended 6 to 12 months after the primary dose. Live attenuated BioVac, single dose IM after first year. Storage: 2 to 8 degrees Celsius. Varicella virus Chickenpox vaccine. A live attenuated varicella virus vaccine, Varilrix, Ocavax, provides a high degree of protection against chickenpox. It is quite expensive. Indication: active immunization against chickenpox after 1 year of age. Dose: Varilrix is administered as a single dose, 0.5 milliliter SC, 1 to 12 years of age. Thereafter, that is, 13 years and later, it requires to be given in 2 doses, 6 to 10 weeks apart. The other varicella virus vaccine, Ocavax, is recommended as a single dose for all ages. Combination vaccines. DTP and MMR are examples of combination vaccines available since 1945 and 1971 respectively. 1. DTPA IPV. It is in use since 1990 in countries where polio stands eradicated and inactivated, killed. Polio vaccine (IPV) is being employed. In India, we are still using OPV. It is, therefore, not yet available. 2. DTP-A minus hepatitis B. 3. DTP-A plus hepatitis B plus Hib. 4. Hepatitis B minus hepatitis A. New combination vaccine in pipeline include MMR Varicella, DTP-A IPV minus Hib minus hepatitis B. Polyvalent Pneumococcal Vaccine. The polyvalent pneumococcal vaccine, Pneumovax, claims to protect against pneumococcal infections like pneumonia, bacteremia, meningitis, and otitis media. Dose. Dose is 0.5 milliliter IM, SC. Revaccination after 3 to 5 years until age of 10 years. Influenza Vaccine. Influenza, flu, vaccine is now available in India under the trade names Vaxigrip, Sanofi Pasteur, and Florix GSK. Dose. 6 months to 6 years. 2 doses of 0.25 milliliter SC IM at 4 to 6 week interval. 6 to 9 years. 0.5 milliliter SC IM at 4 to 6 week interval. Greater than 9 years, 0.5 milliliter SC IM as a single dose. Meningococcal Vaccine. Meningococcal Vaccine A plus C, now available in India, contains 50 mg each of purified lympholyzed polysaccharide of Neisseria meningitidis group A and C. Effectiveness of the vaccine is purely group specific. Dose. Under 2 years, 0.5 milliliter deep SC, preferably in deep infraspinal fossa, in a single dose. 2 to 4 years, 2 injections at 1 year gap over 4 years, 2 injections at 5 year gap. Japanese encephalitis JE vaccine. Indication. Single most important control measure against Japanese encephalitis. Dose. Formalin inactivated mouse drain or hamster kidney vaccine, 2 doses, 1 milliliter each, 0.5 milliliter for under 3 years of age, are administered at an interval of 7 to 14 days subcutaneously. After 6 to 12 months, a third dose is given. Every 3 to 4 years, a booster dose is needed. Live attenuated vaccine, 2 doses, 4 weeks apart, SC. Vaccination against rabies. 1. FLSC, Human Diploid Cells vaccine, is a sure, safe and painless preventive measure against hydrophobia. It is a lympholyzed stabilized suspension of rabies virus completely inactivated by B-prolactone. It is prepared on the human diploid cells. This vaccine is given as 1 milliliter subcutaneous injections immediately after exposure on 3rd day, 7th day, 14th day, 30th day, and 90th day. PCEC, Purified Chick Embryo Cell, is next to HDC in potency. Its administration is in the same schedule as for HDC vaccine. Seroprophylaxis with rabies human immune globulin RHIG 20 IU per kilogram or rabies animal immunoserum 40 IU per kilogram as a single injection is recommended in all cases with severe exposure. It should be given as soon as possible, preferably immediately after the bite.